My name is Michael Devitt. I am a medical oncologist at the University of Virginia Comprehensive Cancer Center, where I'm an associate professor of medicine and urology. Today, I'm going to talk a little bit about the role of cabozantinib in the management of metastatic clear cell renal cell carcinoma. As a brief background, cabozantinib is a multi-targeted TKI targeting the VEGF, MET, and AXL pathways. And it has been approved for the first and second line use in metastatic renal cell carcinoma. So the first data we saw showing superior efficacy of cabozantinib was the METEOR trial, which was a phase 3 study in the second line setting for patients who had previously been exposed to a VEGF TKI. This study was a one-to-one randomization of patients with refractory metastatic clear cell renal cell carcinoma to either cabozantinib or sunitinib, with a primary endpoint of progression-free survival, but overall survival was a key secondary endpoint on the study. In this trial, cabozantinib was shown to be superior to sunitinib in both PFS, OS, and overall response rate, with a median PFS of 7.4 months versus 3.8 months in the everolimus arm. The median overall survival on this study for the cabozantinib arm was 21.4 months versus 16.5 months in the everolimus arm. So this study was the first to show superiority of cabozantinib over the pre-existing standard of care of everolimus in the refractory setting. Shortly after this study, we saw the data from the phase 2 randomized Cabozantinib study, which looked at the frontline use of cabozantinib in the treatment of intermediate and poor risk metastatic renal cell carcinoma patients. And this compared in a randomized one-to-one fashion cabozantinib to sunitinib. Again, the primary endpoint of this study was PFS, with overall survival and overall response rates being some key secondary endpoints. This study again showed the superiority of cabozantinib over the standard of care sunitinib, with a median PFS of 8.6 months in the cabozantinib arm versus 5.3 months in the sunitinib arm. At the time of initial publication, there was a trend favoring overall survival for cabozantinib, but it was not statistically significant. And again, this study was the first evidence really that showed cabozantinib was a superior treatment in the frontline setting for intermediate and poor risk metastatic renal cell carcinoma. And this paved the way for the most modern and current standard of care treatments, which is combination therapy. So importantly, in the Checkmate 9ER trial, which was a phase 3 randomized controlled study of cabozantinib plus nivolumab in combination versus sunitinib monotherapy in treatment-naive advanced clear cell renal cell carcinoma, over 650 patients were randomized in a one-to-one fashion to receive either cabozantinib and nivolumab versus sunitinib monotherapy. The primary endpoint, again, for this study was progression-free survival, but overall survival, again, another key secondary endpoint. This study demonstrated superiority to the combination of cabozantinib and nivolumab arm with a median PFS of 16.6 months versus 8.3 months in the sunitinib arm. And in addition, the median overall survival, which was not reached for either arm at initial publication, showed a statistically significant benefit to the combination of cabozantinib and nivolumab with a hazard ratio of 0.6. We have more recently seen final long-term follow-up data, which puts the median overall survival of the cabozantinib and nivolumab arm at 46.5 months versus 35.5 months in the sunitinib arm, so nearly a 1-year improvement in median overall survival. Also, some important other key secondary endpoints. The overall response rate for the combination arm was substantially higher at 55.7% versus 27.1% in the sunitinib arm, and initial responses seemed to occur faster with cabozantinib plus nivolumab. The tolerability of the combination of cabozantinib and nivolumab was similar to sunitinib in terms of the frequency and severity of adverse events. And importantly, in patient-reported quality of life metrics, the safety profile of cabozantinib plus nivolumab seemed to be superior to that of single-agent sunitinib. So the Checkmate 9ER study demonstrated superiority of the combination of cabozantinib plus nivolumab over the prior standard of care, which was single agent VEGF TKI in the form of sunitinib, both in terms of progression-free survival and overall survival outcomes, but also in terms of quality of life and tolerability, establishing combination therapy as the new standard of care for cabozantinib plus nivolumab, in addition to multiple other combinations of both other immunotherapy and immunotherapy combinations with nivolumab and ipilimumab, as well as other VEGF TKI plus immunotherapy combinations. So in conclusion, cabozantinib has demonstrated significant efficacy over the prior standard of cares, both in the second line and first line setting. And in the first line setting, in combination with the immune checkpoint inhibitor nivolumab, demonstrated not only improvement in progression-free survival and overall survival outcomes, but also safety and quality of life metrics. Thank you.